The only thing that we're doing right now is not focusing on that billing and claims component. We have that as a prototype at this point. We just don't want to be like a child prodigy kind of shelved away and saying, you guys have too much on you and we don't want to be talking about it, right? So we do have that component and it's a prototype. We started building on it. But when we started to talk to investors, they felt that we're kind of stretching ourselves too thin and doing too many things at one time. So we've put that whole RCM component to, we've shelved it and we've put it to a point where we can bring that to fruition the moment any of the, specialists or the doctors ask for it as an added feature to be added to the, to the platform. When it's done with the capabilities of AI, there is definitely lesser errors. You can actually submit a claim as soon as the rejection happens, where a physical person doing it, once they go through the different claims and they come back to seeing what's rejected and what's not, it takes a whole lot more time between, the actual claim processed and being sent again. So this definitely is going to be a big game changer.
Hello there and welcome to Skyman and the Bug. I'm the Bug and that is
the Skyman.
We are here to build relationships, technology, and work on the many wonders of being a business owner and a nutcase. Thank you for joining us, and we look forward to you listening to us, laughing with us, and taking the journey with us as we build businesses and relationships. Well, hello again and welcome to another episode of Skyman and the Bug. My name is Nike Roach. I am the Bug, and my co-host is
Josh Schuminsky, the Skyman.
And we get together with dynamic individuals from across the globe, here in the States, but across the water, about what they're up to. And sometimes we get these rare findings that you find something that is unique, both in the communication space, the health space, and the tech space. And today I get to talk with the CEO. And I want to pronounce the name correctly, Lalitha Ramamoorthy. And I'm glad
you got that.
Oh,
I
got it. And she is the CEO of Hikigai. I hope I got that. And we're going to learn more about it. First of all, and I'm going to ask you just off the cuff, how'd you get down this path way before you were official?
Well, it's not a very long story, but I think health and well-being has always been the core of my living from early childhood. I grew up with my grandma and grandpa back in India, and I still remember that the one thing that my mother or my grandmother used to say is, you can earn everything, but health, when lost, is not something that you can earn. So that kind of resonated very strongly to me, and that upbringing and that core value kind of developed everything else going forward to becoming, making me a healthcare professional in nutrition and food science. And I love food and I love cooking. So that kind of brought me into the
food.
The
I love food. Can you see my face? I am very.
I see it. You're well made, Nick.
Nike, by the way, Nike, because as I said, we all get we have unique family names, so we keep on moving.
Yeah. So so the aspect of wellness is definitely you are what you eat. And I strongly believe in that.
I'm sorry, I didn't mean to laugh, but I'm thinking what Nike eats is fish fillets.
Way wrong. And as a nutritionist specialist and someone who specializes in helping people to eat a little better, to hear that from a host is probably the worst thing you can ever hear.
Oh my God, you guys are hilarious. So based on all of that, core values that I've brought in with me in my journey, it got to a point during COVID when I realized that, maybe my niche of where I am and how I'm going to propagate with my clients is probably going to change, because I saw that technology was definitely an interface there, and truly it's going to be easier for me to communicate and reach out to more people through technology. And AI was the buzzword then. It was just kind of getting there, right? Artificial intelligence was kind of the buzzword there. And people were still more concerned about the epidemic. So AI kind of was sidelined at that point, but there was a lot of things going on in the background. And that's really what kind of kindled my spark and I've always had the entrepreneur in me. I've always been my own boss. I never wanted to work for anybody. Call that selfish motive, but
We get it.
that
We
kind of
get it 100%. We are in your park. We are definitely in your park.
yeah, it makes it more easier to be that way. But long story short, that led me to kind of make that perfect marriage between being a healthcare professional and bringing technology in place, and that was definitely not my strength. So I teamed up with a very good team that we have. The strong tech guys who now kind of are the building block of Hikigai, and yeah, so here we are with what we have to offer with Hikigai.
So
So
go ahead, Josh, because I know you're going to ask the mousetrap question.
no. So is your stack built and are you operational?
Yes, sir. We are very much so. We already have a few customers in line. I live in Michigan, so I've got my first one signed up here in my home ground.
No, we're
Yeah.
never coming to visit you unless it's summer.
Well, guys, trust me, we are warm. We make it warmer for you because of people like us. How
I
about that?
love it. I love it. I love it. Continue.
Yeah, but
Go ahead.
yeah, so we are up and running. We do have a first customer that we've already signed up in Michigan. We've got a few in New York, and possibly some others coming up the early of first quarter 2026. So it's an exciting phase.
And you guys B2B or B2C?
We're B2B at this point. So we would our customers are going to be physicians, healthcare professionals, and our next tier will be to the hospitals.
Well, I saw that you move into traditional EHRs and those in EMR, excuse me. Now, are you at the phase, like you said, the hospital moving into some of the big gorillas that run, the managed, Epic, if you will, or Cerna? Are you in that park yet, or you're kind of pre that place yet?
Well, that's a great question. Well, we definitely have kind of basically. Let me explain what the platform is. Right, we are a bridge for, or I should say, we are an extension of a family physician's office, where we are able to provide assistance in terms of providing the AI scribe. That's one of the most important products that we have, which we offer free. That's free for life. There's no hidden agendas there. And then we bring in the Care Pilot, which is actually our premium model, and that's the paid model that we bring in, which really is the core of Hikigai, where we bring in, we tie up to the EHR, the native EHR, whether it's Cerner or whether it's Epic or Athena. And since we are FHIR approved and we are also compliant with all the requirements there, we are able to integrate with any EHR system that is FHIR approved. So that makes it easier. So one step at a time.
So,
And so we're able to integrate with the EHR,
mhm.
um, copulate all their information, provide it to the doctor at much more faster, efficient space than the doctor would, and make it more readily available, and also have other information where we connect to, wearable devices,
Mm,
or
mm,
other
mm.
social information or other environmental information that we can bring in to tie up to give a comprehensive picture, and I should say a digital twin of the patient, if I may say so. So that kind of makes it a whole lot easier for the doctor to then diagnose, where it's less fault in the diagnoses, and there's not the chances of misdiagnose or misdiagnose, if I may say so. So that's one of the biggest concerns today in healthcare, where you have misdiagnose or misdiagnosis. So we are definitely, a great bridge for that, and we're kind of working our way through. To answer your question, we're not competing with the big giants, the EHRs. We do have our own, AI infused EHR, which we actually had created exclusively for a different demographics. We, considering that the founders are all from Asian Indian origin, we kind of, did our initial testing the waters in India, but then we still found that the market in India is very, it's still in the nascent stage, and they're still working on pen and paper in terms of documentation and all of that. Yeah, many, very much so. There's a huge spectrum, right? You have these big hospitals where they have working with really cool softwares, and then you have others which still have filing cabinets which have paper and pen, and some of them swear by it. They don't even want to
You,
move anything.
you know,
Uh,
I was in the Caribbean a little while ago, and funny you should mention that.
mm,
And I remember walking into a records room, and
yeah,
it's similar. The records room with stacks, just one on top of each other from floor to ceiling of just
right.
records. And I asked myself, okay, how do you one access that medical record, that past history, to see what's the patient's history? Two, who goes through that thing? And if you're an active physician or healthcare provider, how are you going to reference that when you have those? And again, in most of the world, records are not digitized. I realize that, but this was like uh, it was unique because coming from here in North America, you don't see that very often where you have these really large, and I'm not talking about file cabinets. That's a little bit more advanced. This was just stacked and stacked and stacked. And it
Exactly.
was public health. So, with public health, the money may not be there in some respects. So it was just a whole room. And I was like, wow. I mean, how do you even manage care and even make sure that you're not misdiagnosed because you don't have the previous history, the family history or the history that presents itself right there at the patient level. So this is unique. This is a whole different kind of game,
It is.
game of
It is.
chess, if you will.
Yeah, so that's really why we created that AI-infused EHR, which is far ahead in the game in terms of the legacy EHR systems, but we're not in competition with the big giants at this point. We just want to have that available if there is an opportunity for us to kind of extend it to, other countries, and also probably bring in the possibility of integrating with specialty practices, which probably see the need of an completely AI-infused EHR system. So that's where we are.
I think you're on the forefront because especially if you're looking at specialties and other, uh, uh, similar or co-located healthcare practices and stuff like that that may see the need for an AI infused system, especially. And I saw that you have a billing component, which I was like, really? Because I'm telling you, it hadn't worked in the space a little bit. The billing system is a nightmare at
That's right.
every level. I mean, if you're at a hospital level, well, hospitals are a little better at it, but small practices, it's a challenge. All because if you're selling it to the whoever is the payer, if you will, they have a
Mhm.
certain way that they do it, and if it's done wrong, it's coded wrong, or something is wrong, you don't and you send it downrange, it might take 90 days for you to actually get that
Exactly.
you might get
Yeah.
that thing fixed, and you can't submit it the same way. You have to wait a certain, like a cooling off period, which is ridiculous. And then you have to resubmit, and hopefully you got it right this time. But do you have a checks and balance system? And I'm assuming there's a way so that when you send it, Billy, you have less errors and less likely that's going to be denied on the face of errors. Not necessarily might not be denied anyway, because that's what insurance companies do. But on the face of error, maybe you added too many codes in there. Maybe it's miscoded or whatever it is. It's put in the wrong place. It's made out of blue paper instead of red, whatever. Um, it gets weird. So is that a component that you have built in with your system?
Yes, and the only thing that we're doing right now is not focusing on that billing and claims component. We have that as a prototype at this point. We started off, the I should say we are a matured baby. We have so much potential that we can bring in, but we just don't want to be like a child prodigy, kind of shelved away and saying you guys have too much on you, and we don't want to be talking about it, right?
Mm-mm.
So we do have that component, and it's a prototype. We started building on it, but when we started to talk to investors, they felt that we're kind of stretching ourselves too thin and doing too many things at one time. So we've put that whole RCM component we've shelved it, and we've put it to a point where we can bring that to fruition the moment any of the specialists or the doctors ask for it as an added feature to be added to the platform. So yes, to give you an answer for that, we do have that. And when it's done with the capabilities of AI, there is definitely lesser errors. You can actually, submit a claim as soon as the rejection happens, where a physical person doing it, once they go through the different claims and they come back to seeing what's rejected and what's not, it takes a whole lot more time between, the actual claim processed and being sent again. So this definitely is going to be a big game changer. But right now we're kind of shelving it, and we're keeping it for a little later, maybe sometime the next quarter, or the later quarter of 2026.
Mm-hmm.
But right now, the main products we have is the AI Scribe, which is free forever, our Care Pilot, which works efficiently to provide the CDS's support, which is not rule based, but it's more ambient and based on current and real time, and also the infused EHR, the AI infused EHR.
So, are you going after the 15% of the healthcare systems that don't run Epic or Cerna?
Well, a great question, Josh. We would love to pretty much kind of target the smaller clinical practices, which is more of the primary care physicians. There is about 1 million primary care physicians. And even if we are able to get about 5% of that, we're definitely hitting a big target there. And so to answer your question, we are working with the smaller clinics. Some of them are, they have other EHR systems, like we're working with eClinical Works, Practice Fusion. We just came across another one called Emma that they've been asking us to integrate with. So anything that's FHIR approved, or that can comply with the fire approval, we can integrate with. So we don't have a restriction there, but we've already integrated with Cerna and Epic. But Cerna and Epic already have their own infused AI Scribe. So we may not be able to qualify to, kind of sell the AI Scribe, but then there's the Care Pilot we can definitely market for.
Mm-hmm. So Hikigai, talk me through that name, because I've not seen that before.
Well, Ikigai is a very important philosophy of the purpose of life, if you may have heard about it. It's a Japanese philosophy where you talk about purpose of life, and there's actually 5 different components to it. And we wanted to make that as a purpose of health, and that's how we we were very fascinated about this Japanese terminology. And 2 of the founders, have very strong base in terms of following that philosophy too, and one of them is me. So having kind of made our rounds through different names, we initially called it a different name, which was more like a generic name, which was more made by the engineers, I should say, which was a little bit more, it was more like a health knowledge graph. And then we went through iterations, and we were calling it HKG. Nothing was resounding, and nothing was kind of falling in place for us. And then we said, you know what, Hikigai sounds really cool, and we add an H there, and that makes it. So that's what it is.
That's creativity in a nutshell. It's like we tried it
It
with the
is.
engineers, and they came up with something that engineers do. Hey, it works.
Yeah.
It works.
Yeah,
It's
don't
clean.
don't quote me on this, but my partners are definitely gonna not be appreciating that, but
No,
that's
no,
all right.
I have mad respect for engineers because they are very exacting, but engineers, they look for the bugs in things, and that's their job, and they
Yeah.
do a wonderful
Yeah,
job at finding the fault. And we need
absolutely.
engineers in life, but sometimes you need a little creativity in there, baby.
Yeah. So no, we went through different iterations, and yeah, believe it or not, it wasn't easy, because when we went through that health knowledge graph, and it wasn't getting noticed, it wasn't getting heard, it wasn't, people always thought about some knowledge graph coming out, it wasn't resonating well. So Hikigai definitely kind of has a cool name to it, and a cool history to it. So yeah.
You need it's all in the name. I mean, think about some crazy names that you never ever heard of, like Google, which did not appear
Yes.
in the English language prior to this,
Yes.
and all of a
Yes.
sudden
Very
pops
true.
up. It's like to Google something went from from a noun to went from a verb to a noun, or a noun to a verb, and I'm like, okay, to Google something, I'm like, oh well,
Yeah.
you're awesome when you start turning things into nouns or
True.
verbs, excuse
Very
me.
true.
So where do you see Hikigai going now? I mean, you obviously, your footprint is right now in North America and India,
Mhm.
because your roots are in India. I looked at your website and I was like, wow, your team is. It's like I was like, you have a lot of Indians in your team.
I know. Yeah. We need to change that picture a little
Oh
bit.
yeah.
I'm a big
I mean, add
advocate for
African in
diversity.
there, maybe a Japanese, because you got Hikigai, and I'm just trying to flavor up the month a little bit. You got a lot of Indian.
No, true, true. I love it. No, no, no. We love who we have as our team, because it just works out perfectly in terms of having them all remotely placed. We don't need an office space for them, so we're saving big time on all our
Yes.
overheads. So, and then we can kind of work on our time schedules very easily. So it really works well. We've got a very dynamic young
I
team. Some
noticed
of them
that
are
you have a
like,
lot of young brains in the works, which you don't necessarily see. You see, middle of the road, kind of a little upper, not quite my age, but somewhere that's where you normally see. But now I'm looking, I see 20.
No one's your age.
Yeah, exactly. But I'm a little older than everybody probably here. But I saw some 20-year-olds. I said, wow, this is fresh minds. It's nice to get a
yeah,
fresh mind around a new idea as opposed to trying to, rebuild an archaic system.
yeah. It's also to compensate the grace for the founders.
You gotta worry about paying people. That's always the issue.
Yeah, but yeah, no, we have a great team, and then we're very proud of what we've been able to build in less than a year and a half with just about a handful of them. There were only about 8 of them, actually, pretty much engineers who built this core product
Mhm.
to where it was in the beginning of 2025 or 2020, later of 2024. We're about a year and a half old. Now we've expanded to kind of having an equal proportion of men and women also. I'm a big advocate of having a lot more women in the team because I think we need more women technologists also in the team, and
100%.
that's kind of cool too. But yeah, as far as the question goes in terms of our vision to where Hikigai goes, we do have our roots in India, and I think that is really more in the research aspect where we have a tie up with the university. We have a AI lab there where we're working on a large language model we'd like to build exclusively for the Indian brethrens and kind of get a good foothold on some solid data that we can procure from there in terms of building that system once that's ready and up and running, and that's happening soon as we speak. So we're doing our works there in that segment of the world, but then we do have reached out to the Arab Emirates. We do have some ties there. We're talking to people, but different demographics have different healthcare policies. So to expand from one country to another, the biggest thing is the policies that kind of put the roadblocks there. So if we want to make some money and we want to see some, ka-chings happening and some sounds happening there, I think we need to work our way through in North America, and then we'll make it further ahead to other places.
So where are you getting your data from? Your
As we speak now, we had some data generated initially for the testings, but now we've already got real customers who were already in the process of kind of getting it tested with them. Like I said, we have an office in Michigan that we've kind of just signed up a contract. Of kindly, a slightly different practice, which is a very niche practice, and then we have another primary care office in New York. So we're definitely going to be generating a lot of data from all of these places, but we've got some synthetic data that was also generated initially to kind of test the product and to see that it actually works.
So what do you need next? I mean, obviously you need more customers. I mean, that's a given. But what is your ask if our listeners are cross swath of business owners, investors, cases who have no idea what business is, but they want to sit there and listen. We love them too, by the way. What would be your ask for our listeners if you wanted them to say, hey, if you can help us do this, you would be in our park and we're looking to join our journey, you to join our journey.
Um, well, the first thing I would say is definitely yes, we want more people to use our product and get more validation. So customers is our first cry out loud, and the second important thing is if we need this company to move on to become a unicorn, which is my vision for the company and the rest of the founders too, is more money. So we need more investors. We need more people who are like minded who actually see the vision of AI being an integral part of healthcare system. There is a lot of pushback sometimes, asking even about a year and a half ago when I used to actually pitch the product or pitch the startup idea, they're like, you guys are like, I don't think you're doing anything that's actually applicable to what's going to be happening in the next few. But the change is so quick that the leapfrog moment happens even before you blink and open your eye.
Mm.
So we are definitely calling out to see if we get like-minded investors who are, seriously looking at the health tech space to grow in the next 5 to 6 years. And the point at which we are seeing autonomous hospitals in function, and then more of the intent of Hikigai is also to be providing healthcare in a very in a planet scale. That's our tagline right now. We're providing healthcare in planet scale is what we want to do. So, investors anywhere around the world, if you're able to kind of see this as an idea that you would pick on and tap on, um, we're up and about.
Cool. Well, Lalita, and I hope I pronounced that again correctly.
You said it
Oh,
right
good. Thank
both the
you.
times.
Thank you very much for being here, and thank you for sharing your passion and your innovation. Which I, there are not many out there like what you're doing, especially when you're looking at some of the parts we talked about. And I appreciate you. It sounds like you're busy, with all the different things, coordinating movements between all the team members, all the evolutions of the different things, testing out, getting new customers, to getting investors. We have been down that path as business founders ourselves. So congratulations.
So
Thank
Lalita,
you.
can you tell Nikkei to lay off the fish fillets? We want him around for a while.
Never giving those things up.
Well, it depends on how often he's eating them. If he's eating them only once or twice a week, and he's actually compensating it with other healthy choices, then I would say don't give away your favorite foods. But
See, a nutritionist has told you to stop bothering me about that.
I'm not going to stop bothering you about it.
No, but as long as you're staying healthy, and I think just like I said, you are what you eat. So if you are going to see your body telling you that, you will change what you should be changing. I should
You're
say. Will
modifying.
is subjective, but you should is what I say.
Thank
Well,
you.
thank you for the great advice, and we want to keep him around for a while. It was a pleasure meeting you, and look forward to our next encounter.
Thank you very much. You guys are awesome, and I love your title, the Skyman and the Bug. It really kind of is very fun, and I really didn't think that this was the agenda for me today. I was thinking it was a more serious conversation that we would have,
No.
but you made it very easy, and a lighter moment of it. So thank you very much to give me the opportunity to talk about our passion, and good luck with everything that you guys are doing.
Same over there.
Thank you.
We'll see you
Thank
next
you.
time,
Have a
and
good
we'll
one.
see you
Yep.
in the stars or on some traded ticker tape somewhere. How's that?
Absolutely. Absolutely.
All right.
Wish us well. Thank you very much.
You're welcome. Bye.
Thank you.
Yep. Bye now.
You've been listening to
The Skyman.
and the Bug. We appreciate you being here. Join us again for another episode of Skyman and the Bug. And if you have any questions, reach out to us either on LinkedIn, Facebook, and other places that you just try to find us.
Take care.
Bye.